Hi, my name is Amy Freund, and my colleagues Katie Flerlage and Nikki Penwell and I are presenting on alcohol abuse and addiction. We'll be giving a brief look at the history, influence, and effects of alcohol abuse and addiction. Additionally, we'll discuss creating safe and healthy boundaries and environment for the recovery and support system for the alcoholic. Finally, we'll address family education, including effective treatment methods. Dialectical behavior therapy has been found to be successful for families with a loved one struggling with alcohol addiction. Alcohol is the oldest and remains the most widely used psychoactive drug in the U.S. and world today. Its early use is documented in the first book of the Old Testament in Genesis chapter 9, where Noah plants a vineyard, drank some of its wine, and became drunk. Nearly every country has gone through periods of restricted or banned use of alcohol, Islamic countries being the exception. For example, in 1920, prohibition in the United States legally prevented the manufacture, sale, or consumption of alcoholic beverages. It was lifted because then and now taxes on alcohol play a major role in federal and state budgets. This makes alcohol a legal drug with 17 million Americans considered heavy drinkers. Alcohol use ranges from abstinence, experimentation, and social recreational drinking to habitual use, abuse, all the way to addiction. There is no clear-cut line that delineates an addiction. The DSM-5 lists diagnostic criteria for alcohol use disorder and specification for current severity, identifying mild, moderate, or severe symptoms. Both the World Health Organization and the American Medical Association view alcoholism as a specific disease, and they define alcoholism as, quote, a primary chronic disease with genetic, psychosocial, and environmental factors influencing its development and manifestation. The disease is often progressive and fatal. It is characterized by impaired control over drinking, preoccupation with alcohol, using alcohol despite adverse consequences, and distortions in thinking, most notably denial. Each of these symptoms may be continuous or periodic. Problems and risks associated with alcohol abuse include polydrug abuse. For example, people will be more susceptible to use tobacco and or marijuana. Mental health concerns, increased aggression and violence, and increased injuries and suicide rates. Drinking under the influence is another big problem, and fetal alcohol syndrome. There is no one single cause of alcohol addiction, but many factors. Many things influence the development of an addiction, and so while we don't know yet how these various influences combine to form an addiction, what we do know is there are two basic types. One type of influence is biological forces, such as a person's genetics. The second is environmental influences, including people's life experiences, early life experiences, interpersonal relationships, and culture all heavily influence us. The biopsychosocial spiritual disease model of addiction recognizes these different aspects of addiction are interrelated. Genetics and brain function are the primary biological influences for risks of addiction. Various studies estimate the hereditability of alcoholism as high as 50 to 60%. Each individual has a unique physiology and genetic makeup and responds differently to the effects of alcohol. Therefore, understanding your genetic vulnerability is vital. Alcohol is absorbed in the bloodstream, metabolized by the liver, and then quickly absorbed by the rest of the body. Gender, age, and weight affect the rate of absorption. Blood alcohol concentration of 0.08 is considered legal intoxication in every state in America. As far as pregnancy, alcohol use during pregnancy has as much of an effect on the fetus as it does the mother. In fact, it kills cells and changes the wiring of a fetus's brain. And related to mental health concerns and issues on the psychological aspect, because alcohol is a depressant, heavy drinkers are 5 times more likely to experience depression and twice as likely to experience anxiety. It is an accessible and acceptable way to self-medicate. Those who struggle with emotional regulation, impulse control, and social discomfort, they have a higher risk for using alcohol to cope with situations they're facing. It's not uncommon to hear the expression of someone having a drink to relax. 15 to 25% of emergency patients were tested positive for alcohol. Individuals with childhood trauma and PTSD have a higher prevalence of addiction. The younger someone starts drinking, the greater chance they will develop an alcohol or tobacco problem later in life. Underage drinking is associated with numerous negative consequences, such as stunted emotional growth, unsafe sexual practices, poor academic performance, and a higher risk of suicide. And the social influences, one of the strongest factors in both the development and prevention of adolescent substance use is the family unit. A lack of family cohesion can cause emotional distress, which is identified as one of the most problematic motivations for alcohol use. Parental monitoring can be a protective factor, and family routines and positive interactions have been associated with less alcohol use during adolescence. For every person with a drinking problem, there are at least 5 people who are affected. This is certainly true within families. Some of the cultural factors, environmental factors such as the social setting has an impact on alcohol use. For example, France has a higher volume of wine consumption and Russia a higher volume of vodka consumption. Certainly there's settings where peer pressure influences the use of alcohol. Since alcohol is legal, it is readily available in many American homes, making underage drinking common, and 47% of college students admit to binge drinking. Poverty and abusive living environments also raise susceptibility for addiction. Worldwide, 3.3 million deaths were attributed to alcohol misuse in 2012. Excessive alcohol use is the third leading cause of death in the United States, accounting for 88,000 deaths per year. Media exposure helps influence the social norms about alcohol through advertising and stories in a wide range of sources, including movies, television, social media, and other forms of entertainment really influence the drinking in our culture. Alcohol consumption is included in many celebrations, and it's seen as a rite of passage. Some of the spiritual reasons for alcohol use is emptiness, a sense of meaningless or lack of purpose and hopelessness. It can help numb the feelings of disconnection with God and others. In Addiction and Grace, May argues that addiction can also lead us to a deeper appreciation of grace. Empirical evidence indicates a stronger rate of recovery when integrating spirituality. It is not surprising, then, that more adults in the U.S. with alcohol use disorders go to Alcoholics Anonymous than to professional treatment. 74% of professional treatment providers will include AA as one aspect of service delivery. Nikki is now going to talk about what is helpful in the addict's recovery and support system.
Thank you, Amy. My name's Nikki, and I'm going to be covering creating a safe and healthy environment for the alcoholic. Much of my information comes from motivational interviewing training taken with Jane Gavriel in 2018. When it comes to creating a healthy environment, one of the key details that you want to use is unconditional positive regard. This is one of the core tenets of person-centered therapy, and it can be very effective among family members. A lot of times addicts deal with shame and guilt and self-worth issues. Within a family, if the family views them with unconditional positive regard, it can help the addict feel like they're more valuable. This does not involve enabling addictive behaviors. Enabling is what happens when you make it easier for an addict to pursue their substance of choice or any other substance. This also doesn't involve codependency. Codependency is where you take unnecessary responsibility for another person. This can be blaming yourself if somebody relapses, or taking on responsibility for another's feelings. Unconditional positive regard includes lots of boundaries. So within this, you can say, I will show you love and respect, but I won't allow you to come to my home drunk. Or I'll show caring for you, but I won't allow these actions. By enforcing boundaries and having boundaries in place, you are showing love to the addict, even if it doesn't feel that way at first. For person-centered therapy and as well as motivational interviewing to work, having a strong sense of self is incredibly important. This is why self-care and seeking treatment is important for family members who are living with an alcoholic. One way that this can be achieved is through community. Everybody who has been affected by alcoholism needs to recover within one. Humans are made for connection. We easily connect to others, and if we aren't connected to somebody, it makes addictive behaviors easier to pursue. For the alcoholic in active addiction, some of these meetings can include Alcoholics Anonymous or other types of 12-step meetings. There's also group counseling for the alcoholic to pursue. However, family members often need treatment as well. It is definitely true when they say that alcoholism is a family disease. Family members almost always benefit for pursuing counseling. This type of counseling is different from the counseling that the alcoholic receives. It often focuses more on self-esteem and working through the emotions surrounding the behaviors of the alcoholic. It also involves looking in yourself as to why you accepted the behaviors for so long. It does not mean that you are to blame for the other person's actions. It just means that you understand how your actions contributed to the situation. It also provides a safe place to discuss your emotions. Living with somebody who's in active addiction does increase the potential to be hurt by their actions. And counseling is a very safe place to go over those feelings. The final resource I'm going to discuss is Al-Anon. This is a group meeting that has been created for family members who have been affected by alcohol. It is free, and you can use your local resources to find a meeting. Many times a quick Google search will connect you with one. There's groups for teens and adults, and it provides an amazing resource for individuals who have been affected by alcoholism. Now, to go over educating families, we have Katie, who's going to go ahead and take it away.
As a family member of someone who is struggling with alcohol abuse, there are many different things that you can do to help keep your loved one safe. According to O'Farrell and Clements, providing education about substance use disorders and recovery and an opportunity for family members to talk about their concerns is critical to helping them support the person who is in treatment and can alleviate anxiety and other negative feelings that they may have. With this in mind, in addition to attending Al-Anon meetings, which was discussed earlier, you as a family member can integrate yourselves into the treatment. This can be done in a group setting, and I will be discussing dialectical behavior therapy, also known as DBT. Within DBT, families can attend comprehensive skills training groups with other families that are also experiencing similar struggles. According to Rathis and Miller, DBT focuses on the dialectic stance of acceptance and change. As family members, you can learn to help your loved one who is struggling with alcohol abuse accept where they are and push them towards a healthy change. Ritchell, Lim, and Stewart also suggest using dialectical abstinence, which balances the goal of absolute abstinence with a non-judgmental problem-solving approach to setbacks. Dimeth and Linehan say that when DBT is successful, the patient learns to envision, articulate, pursue, and sustain goals that are independent of his or her history of out-of-control behavior, including substance abuse, and is better able to grapple with life's ordinary problems. As a family member, you have the unique opportunity to attend treatment alongside of your loved one who is struggling with alcohol abuse and can learn to speak the same clinical language as a means of keeping them safe. So how can group therapy, specifically DBT, help you as a family member keep the person in your life who is struggling with alcohol abuse safe? A DBT group model may look different depending on where you seek treatment as a family. It may allow for you as a family to attend family sessions with therapists and the person in your life struggling with alcohol abuse. You can also attend group processing, where you will meet with other families struggling with similar issues, while your loved one processes their alcohol abuse with their peers and therapists. If your loved one is an adolescent, you may attend parent processing groups where you can process your child's alcohol abuse with other parents. Multifamily groups may also be included. This will allow for you to process issues particular to your loved one's alcohol abuse with other families. Lastly, you will attend DBT skills training groups, where you will learn the modules of DBT alongside your loved one. DBT has 4 modules, which are mindfulness, distress tolerance, interpersonal effectiveness, and emotion regulation. For adolescents, there's an added module called Walking the Middle Path, which focuses in on things such as common thinking mistakes that may lead to your adolescent engaging in substance use. Mindfulness, which can be thought of as the backbone of DBT, will help you and your loved ones learn to feel the present moment in a non-judgmental way. In distress tolerance, you will learn coping skills that can be used when your loved one is in crisis and has the urge to drink. Interpersonal effectiveness will teach you and your loved ones how to get your needs met and how to communicate effectively, which will hopefully decrease those drinking behaviors. Emotion regulation will help you and your loved one to learn about emotions and how to engage in behaviors that are not maladaptive. Throughout DBT skills training, you will learn these modules, which will help to keep your loved one safe. So what can you do as family members from here to help someone that you love who is struggling with alcohol abuse? First of all, it's crucial to keep up to date on the facts and to know all about the harmful effects of alcohol abuse. In addition to that, knowing the biopsychosocial spiritual disease model is helpful in understanding alcohol abuse as a whole. As family members, remember to create that healthy environment and to engage in the self-care. Lastly, keep an open mind in treatment involvement and learn the skills alongside of your loved one who is struggling in order to create a safe environment that's healthy for them and for your family as a whole.
These are the references that we used. Thank you for watching. This concludes our presentation.